Okay, it's been 1 year since my original mommy makeover surgery where I did the tummy tuck and swapped out my implants and did some full body lipo. And then it's been now another 3 months since my revision of the tummy tuck where we had some dog ears, did a rhinoplasty, mini arm lift, and some more lipo. A year out, I did see my photos from last year, and oh my gosh, I'm shocked at how different I am, and you kind of forget. I was kind of feeling like, gosh, I still feel like I need to lose weight. And once I saw the pictures, I said, oh my gosh, like I have changed a lot. So, big thing is be patient, give yourself time. You probably are forgetting what you started with if you haven't felt like you have a big difference. Pull out those old photos and look at yourself because there probably is a lot more change than you think. We just focus on what we still want to perfect because that's how we work, is that we're perfectionists and want things just in our minds what we think they should be, and lose track of where we are with our new normal. So I did see my photos, and I was just completely shocked at how I was before. So it's a big improvement, and I still am changing and trying to always get better. As far as pain or anything, nothing. The only thing that I did find that I'm uncomfortable is that if I go get massages and have to lay on my stomach, it just hurts with my implants because they just feel hard still. So I'm thinking over time they'll soften. I do think they're still dropping. As far as my most recent surgery, little numbness on the back of my arms here. So you can see my scar. It is lightening up. This was more bunched looking before. It is lightening. Still have some swelling in here, and I actually think I might have some maybe undiagnosed lymphedema all along, and that's why my arms have been so big, because they started when I was a teenager, and no matter how much weight I lose, I've always had big arms. So I'm actually looking into getting a medical grade compression device. So if people are out there struggling with larger extremities where you're just maintaining fat, no matter what kind of diet and exercise, you may want to look into some, if you have some undiagnosed lymphedema. So maybe some just inadequate drainage of your lymphatic system, which can cause you to collect fat cells more in your extremities. So anyway, I'm looking into that, which would help too with a lot of the fluid. My weight is exactly the same from 1 year ago, which is kind of strange considering they did take out 8 liters between the two surgeries of fat. And I do, work out. I have not lost any weight on the keto, but I'm not sticking to it as well as I should. Went on vacation, but it's just kind of frustrating for me that I still have not lost weight, even though I know with lipo you're not supposed to. It's just weird to think they've removed 8 liters and I'm still the same, and all the skin as well. Here's my other arm. This one's smaller than the other. It's always been my smaller arm, so you can see that the surgery scar is fading. Still a little bunched, but it's getting there. And again, this one. And you can kind of see it's just purple, but getting better all the time. Rhinoplasty, it looks pretty normal to me as far as I look like nothing was done. No pain, no numbness, nothing with my nose. For my implants, this is from a year ago. Still a little hard here, but they are softening up. And then I have my scars under here that you can see. And then I'll show you my waist. So this is where we're at, a year out from original tummy tuck. I still have some fluid around here, I can feel it. And then this was the new incision that comes all the way around there. And again, all the way around there. But as you can see, with like regular underwear, it completely hides it. So, and then thighs, this is where we're at here. I need to tone up, but again, I maintain in my thighs, so that's why we're looking into these compression devices to help with some fluid. Also trying to lose weight as well. At my work, I do some cool sculpting, so I'm actually going to be probably at some point doing more cool sculpting too. Just looking into it. I do fascia blast, which I think helps break up some of that hard fascia fibers that is in place, and drinking lots of water and trying to just stay as active as possible. Everything's going great. I have no more plans for surgery, just kind of doing little things on my own, and then at my work, since I have availability for doing some of those other things just at my work. So if you have any questions, let me know as far as where we're at for a year out. As for arm lifts, nose, anything like that. Again, I am a nurse, so I have some more medical knowledge and work with aesthetics all the time. So if you have any other questions, let me know.